stand by. Our news conference will begin shortly.
Good afternoon, everyone. Welcome to the media event, media advisory again today, or media availability. And I will turn it over to our Chief Medical Officer of Newfoundland and Labrador, Dr. Janice Fitzgerald.
Thank you, Premier. Good afternoon, everyone. So today I'm advising that we have 32 new presumptive positive cases in Newfoundland and Labrador. Western Health Region has its first case. It does appear to be travel related. However, the investigation is ongoing and I don't have any more details at this time. The other 31 cases are within the Eastern Health Region. This means that we now have cases in all 4 health regions. Public Health is initiating contact tracing, and those who are close contacts will be advised to quarantine. Our total number of cases is now 67. The ages range from 8 to 78, and everyone is still at home. No one has been hospitalized. We have tested 1,336 people. Of these individuals, 1,269 have been confirmed negative. So I want to assure people that contact tracing is underway. I understand that as people are tested, they may experience anxiety as they wait for their results. Public Health is working tirelessly to get results back to people as soon as possible. However, it will take some time for you to hear back about negative results, and we appreciate your patience. As our case numbers increase, the priority will be on contact tracing. This process helps us identify other cases and to prevent further spread of this virus. And we are casting our net wide to ensure that we identify all cases, as many cases as we can, and to help curtail the spread. So the fact that we are finding more cases right now is an indication that public health is doing its job and that it's working. Unless you are sick, a test result will not change the steps you take. You should be staying at home and acting as though you would be positive. If you become sick, you should call 811 for further direction, and if it is an emergency situation, you should call 911. I want to stress that even if you receive a negative result, you are still required to finish out the remainder of your 14-day quarantine. Of the 61 cases in Eastern Health Region, at least 44 are associated with Call's Funeral Home in St. John's. 8 other cases are travel related and the remainder are under investigation. I want to speak now to those who attended the Call's Funeral Home in St. John's on March 15th, 16th, and 17th. Based on Eastern Health's public health investigation, I am ordering you to stay at home and self-isolate until April 1st. This virus for most people presents with mild symptoms. The days of going to work with the sniffles are over. If you are sick, you need to stay home. This is for everyone's health and safety. Thank you.
Thank you, Dr. Fitzgerald, and good afternoon, everyone. Well, as you know, if there's anything that will keep us inside, it's bad weather. Today in St. John's, we are experiencing some bad weather, so I am just fine with that, as it will help us get through this COVID-19 pandemic. We have put several strict measures in place for your safety and said that every measure to ensure that you follow our guidelines. And with that said, for those of you who are supposed to be in self-isolation, some of you are simply just not taking this seriously. One of the consequences, or some of the consequences that we put in place, would be fines. So in addition to fines, we are immediately taking away your driver's license. We will explore every opportunity that we have to put those measures in place on the current legislation that we have. So taking away your driver's license is another one of the consequences, in addition to the fines, for those of you that are not compliant with self-isolation. It's as simple as that. We will take the strictest measures that we have to protect our residents. These are challenging times in our province. These are difficult times. We all realize that. Yesterday, I gave a response to some passengers on the Comatech W. Of course, this is the ferry that goes from St. Barbe to Blanc-Sablon, and with many residents on that ferry from Labrador. Well, yesterday, in my remarks, I said that some of those passengers were put in isolation. Well, it appears to me, coming through reports out of Labrador last night and this morning, that some of those passengers, in particular the ones that we were asked about, were actually mingling with some of the passengers on that ferry. Actually, I reached out to that family, could not reach them myself today to find out more details. But it appears that there were some forms that were not disclosed out, and not completely filled out as disclosure. So I asked people that we would travel on those ferries and on our airlines to properly fill out those disclosure forms. Not doing so is not following the guidelines that we put in place for travelers within our province. We need to be responsible, and we need to be able to protect others against the spread of this pandemic. If we have to, as we said, and as Dr. Haggie and I have said many times, we will use the force of law. For me, it's sad, it's disappointing to even have to make those comments. Simply, we're asking you to stay home, to protect yourself and others. So many people in this world do not have a place to live. So many people in this world would love and would enjoy the opportunities that we have here in Newfoundland and Labrador. So simply staying home should not be something that you find difficult to do. But these measures are put in place in the event that we have to use them to protect others, in some cases, from you. And as we sit here addressing the people of our province every day, we continue, as Dr. Fitzgerald said, to see the numbers rise. It's been said already that this is not unexpected. This is about public health doing its work. Quite often, as has been mentioned already, most of this has been linked to travelers. And we've been saying that and doing this since day one. The measures, we must not forget, are put in place to prevent the spread of COVID-19. I would like nothing more to contain and eventually stop the spread in the quickest way possible, to allow our entire province to get back to everyday life, a life that we've all worked extremely hard for, a life that includes all the activities that we enjoy with families and friends. But as we said many times, this is not days or weeks, this is potentially months away. And we can only make this happen if everyone follows the guidelines that our Chief Medical Officer has outlined. It's only then that we will truly see the change that is necessary to continue and to flatten the curve. The virus takes interaction to spread. It comes down to this: if you don't interact, if we keep a safe distance from one another, we can stop the spread. The more physical interaction we have with others, the more we keep it alive and the more it spreads. We are and we will exhaust every option we have to keep you and your loved ones safe. Public health officials are advised that children are best cared for at home. And that is why we closed schools last week in this province. What we have to keep in mind is that there are essential workers that I'm sure are having a tough time saying goodbye to their loved ones and children as they go through the door every day. They do this as they prepare for another day to keep you and your family safe, but to provide the essential services and supports during this difficult time. So once again, we thank them for that. We have a number of community group homes across our province that provide significant care for some of the most vulnerable youth in our society. It's important to recognize the important work that they do as well. But we have to recognize that we have put measures in place to protect and support you. We also have to put measures in place to protect and support our essential workers, especially those workers who do not have access to at-home or childcare. I have spoken with Debbie Forward from the Nurses Union and to Jerry Earl with NAPE, and therefore today we are permitting limited operation of regulated childcare services for children ages 1 through 13. This is to help support and enable essential workers in providing critical services if there are no other options that are available to them. This service will be provided at no cost. Essential workers include people like healthcare workers, paramedics, firefighters, police, correctional officers, early childhood educators providing essential childcare services, and other public servants required to work during the COVID-19 pandemic. An application process has been launched for essential workers in need for childcare. We ask that you fill out the form as soon as possible. You can find the form on our COVID-19 website. Visit gov.nl.ca/COVID-19. We have consulted with some child care providers who help inform our planning and with public health on how the services can be provided safely. So further information will be provided to child care centers, and we will work with them to facilitate a contract between the applicants and the centers. And we want to thank them for their willingness to step up. Once again, this is at no cost to our essential workers. And we recognize the contribution that everyone is making to our province as we work our way through this situation. For essential workers, a reminder is that the workplace is not a social gathering. Employees and employers are expected to follow all health protocols as best they can. Now, we've been getting questions too in preparing for food security and sometimes a shortage of food for many of residents in this situation within our province. So we are working with community partners to assist in providing food to Newfoundlanders and Labradorians who are experiencing food insecurity due to the COVID-19 global pandemic. So therefore today I'm pleased to say that we will be providing some $500,000 to support this effort. We have several provincial departments that are involved, the Departments of Children, Seniors and Social Development, Advanced Education Skills and Labor, and Municipal Affairs and Environment. These groups will help support the funding for food security. This will include increase in the unprecedented costs for these community providers, such as transportation and supplies. The Department of Children, Seniors and Social Development, they will work in partner with Food First NL, who will be co-chairing this task force on this initiative. The group is currently mobilizing a variety of resources to make food available for those who need it. Also today, we've been working with a company that's been doing and providing a service for Newfoundlanders and Labradorians for some 25 years. That is DRL buses. And they're coming off the road today. We will continue to work with the company to find a solution. We recognize that many people in our province use this service to provide transportation to services that they need for them and their families across our province. We will get through this situation that we find ourselves in. We will get to this working with the great team that we have. You know, it's said that on certain times within our province, that many people have said to me that it reminded them of a quote by a former president of the United States, and of course, one John F. Kennedy. And we're all very familiar with the quote, when he said that we ask not what your country can do for you, but what you can do for your country. Ask not what your country can do for you, but what you can do for your country. And that is the same for us here in Canada. It's the same for us in Newfoundland and Labrador. Is what is it that we can do for our province? You know, our actions today will determine the future and the spread of this pandemic within Newfoundland and Labrador. For those that are watching right now, I want to be very clear. If you're not following the critical guidelines that we put in place, we will not hesitate to take further action. Be responsible and do not for 1 second think about jeopardizing the life of others. As Minister Haggie had said yesterday, the idea of people walking around oblivious to this is frustrating. It is frustrating to all of us. As a matter of fact, it's infuriating that this is not a joke, ladies and gentlemen. The life of a human being is taken, and we must take quite seriously. And I'm pretty sure that the last thing that you want on your conscience when this is all said and done, that you did not take this seriously. The time to contain and to prevent this spread is now. So I want to thank you for this opportunity. I now turn it over to Minister Haggie.
Thank you very much, Premier. We have and are and will be focused for some considerable time on COVID-19. This is the start, and we have an opportunity, as Dr. Fitzgerald has mentioned, about flattening the curve and containing the spread to the extent that it is possible to do so. We have put in place some resources, and they're designed really to enable you to do this from the comfort of your own home. So we've asked people to use the 811healthline.ca website or the government-located self-assessment tool to see, for those people who feel they may have been exposed or may have been at risk from their travel histories and are currently in self-isolation. But this is also, you must remember, flu and cold season. So one of our challenges through our direct contact resources, and I'm thinking of 811 now and 911, is that not everybody who rings up necessarily has COVID-19, even though that may be the first and most foremost thing on their mind. So we are trying our best with 811 to work our way through that. And that service, the direct contact with RNs and trained professionals, has certainly been strained. And over the course of the last 10 days, we've leapfrogged putting extra lines on, putting extra staff on. And by the end of the day tomorrow, PhoneMed, who run that service for us, tell me they will have yet another 25 full-time equivalent staff available to provide advice to people who have health concerns but are not urgent. The key here is also what 811 cannot do. 811 will not clear people to go back to work. 811 will not provide you with sick notes. It cannot do that. And for those of you who are government employees or employed in the public sector, we have been very clear that for respiratory symptoms of less than 2 weeks duration, you do not need a sick note. This is an unnecessary burden on 811, and I would ask you to really think twice before making these calls, because you're not going to get what you want out of it. The other feedback that we have had interestingly enough, since yesterday and the comments I felt constrained to make about the video have been very positive around public health. We have had staff from each of the regional health authorities at ports of entry. They have been making contact with new arrivals, even if it's only handing them information, but making them aware of the requirements. And we have been diligent to meet with every flight that originated outside the province. And again, I want to pass on some of the thanks and congratulations I have received over the last 24 hours to the staff in health promotion, to the staff in public health and our contact tracers. I think people are finally seeing the value of investing in your skills and services. And it's paying off now because, as Dr. Fitzgerald referenced, contact tracing is working and we are pinpointing people who have been affected by this virus. The other piece, the mainstay of our approach at the moment, can be summed up in the phrase of social responsibility. And we have, each in our own way, emphasized that the person, the individual, the community has a responsibility to look after themselves. And in doing so, will contain this. We have, with all the technology we have available now, the means for a lot of employees to work from home. And I'm hearing that they have been set up by their employers to work from home. And you only have to see my own department, where significant numbers of people who would normally have been in are now working, but doing so from home remotely. I would ask those employers who have got the ability to have their employees work from home that they do that and facilitate that in every way possible. If there is no need for them to be in work, they should not be needed to be in work. They can work from home. From my point of view, with the measures that have been put in under Dr. Fitzgerald's orders through the state of public health emergency, we have some of the most effective and stringent mechanisms in place to help contain this. We have unfortunately spent some time over the last couple of days talking about enforcement, and that will be pursued vigorously whenever necessary. We would hope to rely on education and encouragement, but there is, at the back of this, always the issue of enforcement. I'm encouraged each day as I see less traffic on the highway, less people in the office, that the message is getting out there, and I really do think the bulk of Newfoundlanders and Labradorians are actually doing what we ask. The safe thing for you to do now is assume that there is COVID around you and to stay home and stay apart, but stay connected. And with that, I think I'll conclude my remarks. Thank you very much, Premier.
Thank you, Dr. Haggie, and I think we now turn it over to questions.
I would like to remind reporters that your question time will be ending at around 3:25 p.m. as we have only allotted 1 hour for the news conference. We thank you for your participation.
Thank you. We'll now take questions from the telephone line. If you have a question and you're using a speakerphone, please lift your handset before making your selection. If you have a question, please press star 1 on your telephone keypad. If at any time you wish to cancel your question, please press the pound sign. Please press star 1 at this time if you have a question. There will be a brief pause while the participants register for questions. Thank you for your patience. And we have a first question from Patrick Butler from Radio Canada.
Hi. I'm wondering, have any healthcare workers been infected by the coronavirus yet? Are they among the 67 cases that have already been announced?
Yes, we are aware of a small number of individuals who work in healthcare in a couple of settings. They have been advised of their results. They are well and at home self-isolating, and contact tracing is underway with them.
Can you give any further details? And can you talk about, what measures are in place to address any sort of capacity issues that could come up from healthcare workers being affected by the virus?
Certainly, one of the challenges we anticipated early on would have been the one about capacity. Over the course of the last 10 days, all elective procedures, diagnostic or therapeutic, have been cancelled and will be rescheduled at a later date across the entire province. That has enabled us to free up nearly 40% of acute care beds in general and nearly half of our intensive care unit beds. So the capacity there with our current staff exists for a surge. We also, at the back end, and I signed regulations today to allow the College of Physicians and Surgeons and the College of Registered Nurses of Newfoundland and Labrador to provide emergency licenses to recently retired practitioners should that need become apparent. We have, as the Premier announced, looked at making it a lot easier for those healthcare workers who require help with childcare with the reopening in a selected way of childcare places. So I think we're pretty well addressed at the moment to manage any potential surge. I would reiterate what Dr. Fitzgerald has said, in that all of the cases that are presumptive positive and confirmed positive are currently mild and managing at home.
Thank you. Our next question is from Peter Cohen from CBC. Please go ahead. Your line is open.
I think a lot of people are shocked by the number of cases that we're all seeing related to Call's funeral home. And was the person who attended the funeral violating the orders at the time? And exactly what was the total number that we're looking at that are directly connected to this funeral home?
So the index case has not been definitively identified at this point. But it does not appear that anyone was in violation of any orders at the time. If just based on attendance where people were from at the funeral home. And I'm sorry, I've forgotten the second part of your question, Peter. Sorry.
No worries. It was just the total number. Was it 44 cases that have all been tied to the funeral home?
At the moment, the numbers that I have are 44, but some of the numbers have come in just before we came here, so that may change as the day goes on.
There's been criticism that there hasn't been enough information released as these cases are identified about where people were and who was at risk. Today, you're now saying if you were at Call's funeral home, you need to self-isolate. But days ago, that information came out through other means. Will this cause you to reevaluate how much information you release? Because if that information had been released days ago, there would have been people who would have been able to self-isolate a lot sooner and reduce the risk that they are able to transmit this virus further in the community.
So this information is changing very rapidly, and we certainly looking at what's been happening across the country in the last couple of days with regard to community spread. Certainly we've reevaluated how we're doing things, and now we're casting our net quite wide to make sure that we are finding any community cases that may be there and any spread that has happened with regard to this situation. Of note, so far, we have been doing community screening with other influenza-like illness swabs, and we haven't found any cases related to broad community spread through that means, which is reassuring.
Thank you. Our next question is from Ben Murphy from VOCM News. Please go ahead.
Dr. Fitzgerald, you said yesterday that you would be having further discussions on asymptomatic transmission of the COVID-19 virus. Can you provide us with any kind of update? Has anything changed?
Yes, so discussions at the federal, provincial, territorial levels at the last couple of days. We have reevaluated screening with regard to asymptomatic people. We will, going forward, be checking asymptomatic contacts of people who are confirmed cases. And this is to make sure that we find as many positive people as we can and put in the appropriate measures to reduce spread.
One of the startling stats that you said earlier was that the age ranges range from 8 to 78. Can you speak to how many cases are linked to children?
I don't have any further breakdown at the moment than that.
Thank you. Our next question is from Kellyanne Roberts from MTV News. Please go ahead. Your line is open.
Thank you. Allowing regulated childcare centers to reopen for essential workers, are we looking at closing non-regulated childcare, knowing that the spread continues to increase in the province?
No, that is not something that we're looking at right now. What we're looking at here is to support our essential workers. So those, could be nurses, it could be healthcare providers, or it could be people that, would, as I said, are first responders, and the list is available on our website. The application is there. But essentially, this was a way to support our essential workers who would not have child care available to them, so that we can use them, in our healthcare system where they want to be. Quite frankly, what they're looking for is for people like us and our our daycare centers to support them so they can go to work, not having to worry about childcare spaces.
Right. There's also some concern from truck drivers and delivery drivers. What are they supposed to do if they cannot access public bathroom facilities to practice safe hygiene?
Pardon me, Kelly, what was that question again?
Oh, sorry. What should truck drivers and delivery drivers do if they can't access public bathrooms to practice safe hygiene?
Well, the fact is that whatever the setting is, that is not something that has, has come to my attention, that there would be a truck driver that would not be able to practice self-hygiene. I think what you do is you do the best you can to, plan your day around access to those centers across our province in the delivery mechanism. I mean, we haven't shut down service stations. These services are still provided to support those that deliver essential services across our province. So we'd anticipated it's not something, as I said, that I became aware of where there is a problem in someone finding a service station with the supports that's required to support those truck drivers.
Thank you. Our next question is from Peter Jackson from The Telegram. Please go ahead. Your line is open.
Hi. The couple on the Kamatik ferry, there's some. I wonder if I can get some more clarity on what going straight home from travel means, because they would have landed in the island, gone on the ferry to go to southern Labrador where they live. What are the parameters of going straight home? Are there any travel restrictions beyond your first arrival in the province?
The travel restrictions, once you go on the ferry system, the Kamatik W, was that clearly on the website. There are posters around to identify before you got on that ferry if you were just coming back from international travel or even from another province. These are clearly the guidelines in our province, and provisions could have been made in this situation to provide isolation or work with those involved for other alternatives. What I'm told and understand is that disclosure form was not filled out, which clearly would be something that is that people would not. They should be disclosing the information that they were asked. So what I understand, and I've been trying to reach out to the families to figure out what happened here, but what I understand from social media and from people that I've been talking to on the ground there, that this disclosure form was not filled out. We need to figure out why, and therefore why people would deliberately, it seems to me, not fill out this disclosure form.
Okay.
Thank you. Our next question is from Holly Mackenzie Stutter from the Canadian Press. Please go ahead. Your line is open.
Hi, Dr. Fitzgerald. Can you just go over how many of the cases are currently confirmed, how many are presumptive, and if any are resolved?
So at the moment, there's 4 confirmed cases from the NML, and that will be changing as we go forward, in that our lab has now been able to confirm positive cases as well. So tomorrow we'll probably have different information for you in that regard.
Okay, thank you. And I'm wondering if anyone can provide data on how many of the cases linked to travel involve travelers who are in the United States?
At the moment, as far as I know, there was one or two, but I don't have the complete breakdown of where everybody traveled to. As you can understand, there's a lot of cases, so that information is being kept track of at the regional level.
Thank you. Our next question is from Peter Cohen from CBC. Please go ahead. Your line is open.
Dr. Haggie, you mentioned that there have been several healthcare workers that have tested positive. Can you give us a more definitive number? And is there any risk that they would have exposed patients to COVID-19?
Yes, thank you very much. I can't give you the exact number. I know it's small. It's greater than 4, but less than 10, simply because of the way the data has been collected. These are all involve one location in Eastern Health. The staff that may have come into contact with these individuals have all been sent home to self-isolate pending contact tracing, and there were patients who were able to go home and have gone home to self-isolate with the usual follow-up from public health. So that unit is currently being cleaned, and once clean will be available again for patient care.
I think the reminder here, Peter, would be that since there's no patients in hospital right now, this is not something that the healthcare worker would have acquired working with a patient in the hospital setting. So they would have been, I guess, normal citizens doing the things that they do, whether it was at Carl's funeral home or not. I guess we're not sure about that. But the fact is that we do not have anyone in hospital at this point. So this contact wasn't acquired from the hospital setting.
No, it was a matter of staff, not a patient in the hospital. This is not an inpatient with the condition. This is something that was a healthcare worker related issue.
The issue of contact tracing has now become, foremost on a lot of people's minds, but I'm not sure we fully understand it. Can you give us an idea of how many people do you have trying to do this contact tracing, and for something like more than 60 cases, how many individuals are you having to actually contact in order to let them know that they should be self-isolating or maybe need to get tested?
So contact tracing can become quite complicated. There's no doubt about that. Right now, every available communicable disease control nurse and public health nurse in the Eastern Health region is being tasked with contact tracing. In this situation, I don't have the exact number, Peter, but we are certainly talking about a couple hundred people, I would think, with this number of cases.
Thank you. Our next question is from Drew Brown from The Independent. Please go ahead.
Hi. So I've heard from some rural pharmacies that there's been a difficulty in acquiring supply of some basic essential supplies like hand sanitizer, both for customers and for staff, because they need it to stay open. But also some basic stuff like children's Tylenol or even liquid acetaminophen, or inhalers like Ventolin. So I'm just sort of wondering if you can clarify what steps the province is taking to make sure that rural pharmacies are able to get these essential supplies.
We've been in contact with the organizations that represent pharmacists, both community-based and across the province, to ask them about their needs. And indeed, we've actually put them in touch with entrepreneurs who have supplies of PPE, for example. We have now, through the NLC, got a local production line in operation that is actually producing good quality alcohol-based hand sanitizer, and we will be offering access to that as and when supplies allow. In terms of the actual supplies of medication, we have not been made aware from wholesalers of any issue in supplying drugs. They have, however, suggested that unless there is a pressing need otherwise, and to prevent hoarding, that the pharmacists locally would restrict themselves to a 30-day dispense. We have, from a department and a public health point of view, wanted a slightly longer period, and we're kind of working through that process with the Pharmacy Board and the Pharmacy Association.
Perfect. Thank you very much for that answer. The other question is, I remember listening to the press earlier. The Premier made reference to the plight of those who maybe don't necessarily have a safe home or location to sort of shelter in place at. So I am wondering, given that they are a vulnerable population and don't have anywhere to sort of obey the directive to stay home, is the province considering providing housing for the homeless population like we've seen in other jurisdictions?
Yeah, so we're working, with the various groups around the province, and one of the things about the announcement, one of the key things about the announcement yesterday is to continue to provide financial support to some community organizations that work with some of the homeless that we have in our province. And so right now, even with Newfoundland Labrador Housing, with the Department of Children, Seniors and Social Development, there's work being done to work with those individuals. Everyone deserves a safe place to live and a good shelter, and we will continue to work with the community groups and the department to do whatever we can to make sure people are in a safe location in our province. This is something that we deal with not just in this pandemic situation. It can be exaggerated in difficult times, but ongoing situation both here in the island portion and in Labrador as well.
Thank you. Our next question is from Elizabeth Whitman from All Newfoundland Labrador. Please go ahead.
Hi there. I have kind of a question about what work people are allowed to go. So I've heard that. I'm curious, what are the resources for small trade businesses to go for work in regards to worker safety?
I didn't get the end of the question.
No, I didn't either. I'm terribly sorry.
Yeah.
Sorry, I'm in a bit of a loud spot. I'm wondering, what are the resources for small trade businesses when it comes to issues like worker safety? Because I'm hearing that some businesses are getting the call from customers to go out and do work like plumbing and electrician work, and they're turning it down because they don't think it's safe. But then that person calling just kind of picks up the phone book and goes down to the line. So they're missing out on work, and they might not know what are the regulations there.
Well, when it comes to, social distancing and, proper hygiene and making sure that the workers are comfortable going into the various settings that we would find. I mean, this is something that occurs, often within Newfoundland and Labrador. It could be anything from people, helping with communications within an individual's home. It could be something that you could need, some appliance that would be repaired or so on. There's many things that are important to the day-to-day lives of people that live in our province, and they're important to have those services available. So right now, with the companies that are the supplier of those services, is they put in the proper protocols, keeping in mind social distancing with the clients that they will interact with. As I said in my remarks, this virus spreads through interaction. So keeping self-distancing is important, making sure that you have proper hygiene, things like hand sanitizer, and so on. All of these things are important for the worker as they go into the environment. They need to know that they are protected, and that they need to know that those that they interact with are not testing positive, as an example, those that are in self-isolation and quarantine and so on. So all of this information is very important before the worker goes into that setting. So these are regulations and guidelines that can be put in place by the various businesses that offer those services.
Oh, thank you.
Thank you. Our next question is from Kellyanne Roberts from NTV News.
Minister Haggie or Dr. Fitzgerald, the healthcare workers that have tested positive, are any specific to Janeway staff?
From my understanding, they are not.
Okay. And in terms of the current cases we do have, are all still self-isolating at home with mild symptoms?
That is up.
Sorry. Yes.
We got the choir going now.
Yeah.
That's right.
Sorry. Yes, all are still at home.
Thank you. Our next question is from Ben Murphy from VOCM News. Please go ahead. Your line is open.
Mr. Haggie, are you aware of any people now in the healthcare system who are refusing to go to work after these cases have come up?
No.
Okay. And hearing a lot of concerns from different families trying to get their children home from international travel. with only the 4 major airports accepting international flights. Is the commitment to self-isolate when they land in, let's say, Vancouver or Toronto, or would it be their final destination here in St. John's, because a lot of these people are going through many airports?
My understanding is the way that Dr. Fitzgerald wrote the order, it's the minute they set foot in Newfoundland and Labrador, the clock starts for 14 days.
Thank you. Our next question is from Peter Jackson from The Telegram. Please go ahead.
There's a lot of talk about people breaking or violating the orders. We've discovered today, just trying to take pictures of people selling salt, etc., that they're very paranoid about whether they're actually breaking orders just by being outside. Can you explain again the parameters around being outside, whether you're self-quarantined or not?
So we're recommending for everybody social distancing or physical distancing. So if you go outside for a walk, that you try to keep your distance from anyone, regardless, even without being in quarantine. If you've come home from travel and you've been asked to quarantine or self-isolate for 14 days, if you do not have symptoms, you can enjoy the outdoors as long as you are physically separating yourself by the recommendations, 6 feet, from others outside of your immediate family, I guess. But as much as possible, you should try to, separate yourself within your family unit as well. And then if you have any symptoms at all, you have to stay inside at home.
Peter, for ease, both documents around guides to self-isolation and guides to social distancing are actually available on our government website, and they can be read online or even downloaded.
Thank you. And as a follow-up question, I'm curious to know what the situation is with Newfoundlanders in Qatar. Are they mostly home now, or are arrangements being made to keep them safe if they are not actually home yet?
Yeah, the ones that I can speak to would be the ones that are in Qatar from the College of the North Atlantic, those employees. So I understand right now they would stay there till late June. They are working from home, and the conditions and the regulations that those employees would have in place are very similar to what you would see right here in our province. So I understand that it'll be June. We've been working with them through the College of North Atlantic, and they, as I said, they're working from their homes in Qatar.
Thank you. Our next question is from Peter Cohen from CBC. Please go ahead.
We've heard comments from the President of the United States saying he wants to see the United States back up and running by Easter. Dr. Haggie, a question for you. A lot of people are kind of anxious about how long these sorts of restrictions and lockdowns are going to last. Do you share his optimism?
No. We will be guided on our decisions by Dr. Fitzgerald's small but mighty team as to when it's safe and sensible to start easing these. And I think, quite frankly, from what I have heard, such discussions are really premature.
And as a follow-up question, we've seen one brewery in St. John's has been wanting to do home delivery of beer. Similar sorts of deliveries are happening, I think, in Ontario, for example, as a way to allow people to still get beer with limiting their ability to go out. But he's being told that he's not allowed to do that by the province. Why is that?
Yeah, these are regulations, that have been in place for quite some time, and we're, at some point we would like to be able to change those regulations, but we're in a situation right now where there's a number of priorities that we have to deal with, and as we go into the House tomorrow, we'll be dealing with, a number of pieces of legislation so that we can actually get loans, for our province and so on, which would require to continue to pay for the necessary services. At some point, these are regulatory changes, that if we seem necessary in the future, once we get through this situation that we're into, that we could, potentially look at. It's something I know that through the the Department of Finance, I understand that they would like to do, but getting to that maybe not as quickly as some of the people that are in that service, providing that service, would like to see. But right now, the priority for tomorrow's session will be on the immediate issues and the pressing issues that we're dealing with on behalf of the province.
Thank you. Our next question is from Holly Mackenzie Stutter from the Canadian Press. Please go ahead.
Hi, I'm just wondering if you can give details on any system in the works that would set up hotel rooms for doctors or other healthcare workers so they don't have to go home.
We have not had any specific requests. I tell a lie, there was one this morning. That is not something that we have looked at yet. We'd be happy to consider such options, but I think there are a variety of steps that might need to be considered first. So if it turns out that it's a sensible decision on public health grounds, we'll certainly look at that.
Thank you. And just a follow-up about the number of cases we have so far. Has anyone who's been diagnosed or tested positive recovered?
No, as of yet, nobody has reached that milestone.
Thank you. Our next question is from Angel Moore from APTN National News.
Hello. Thank you very much. I understand the Premier was aware of the people on the Academic Ferry yesterday that traveled and did not declare. I spoke with some passengers who got off the ferry today, and they were all very surprised because they were expecting to be told to self-isolate, considering there was no social distancing on the ferry. And the people who did go into isolation on the ferry had to use the public washroom, they had to use the cafeteria. So everyone's gone home now, and the people I spoke to are going to self-isolate. But my question is, why was not Labrador Health, who was there, did not advise people to self-isolate?
Yeah, go ahead.
Labrador Grenfell had personnel there who approached every vehicle that left that ferry and provided them with information on what to do. And indeed, actually, my understanding is also there were personnel there from the Quebec Régie who were also there to assist with that.
Yes, but my follow-up was they were not asked to self-isolate.
The decision as to what to do under those circumstances is one for professionals to make, public health. There was information provided to them to guide their own particular circumstances. I would encourage them to read that. If they have any issues, 811 will be able to help them if the self-assessment tool doesn't. And I would encourage them to use any and all resources if they're in doubt.
Thank you. Our next question is from Patrick Butler from Radio Canada.
Hi. I just wondered if you could give any more details on what people should expect from the House sitting tomorrow. Any sort of anything concrete that you could announce before you talk about before you get in the House Assembly tomorrow?
Well, one of the things that I've just mentioned a few minutes ago was the fact that, given the situation that we're into, in order to keep the goods and services going within our province. Of course, in a province like Newfoundland and Labrador, it's not unusual at this time of the year that we would have to go out, and there would have been a borrowing program to a regular budgetary process that we would have been outlining. So right now we'll be seeking permission from the House members tomorrow to put the province in a position that they could go out and borrow. Helpful yesterday was the news from the Bank of Canada that they would actually support provinces up to 40% of credit. So tomorrow it's really getting the province in a position that we can continue providing services as we go out and seek credit, seek loans from our financing institution to support the services that we provide.
And if I could just ask, how many confirmed cases are there in the province right now?
4.
At the moment, there's 4 confirmed cases, and those are confirmed from the National Microbiology Lab. As I said, okay, sorry.
Thank you. Our next question is from Kellyanne Roberts from NTV News. Please go ahead.
Is there an update for schools? I know many students are getting concerned about public exams.
Yeah, so we, as we said when we announced school closures, last Tuesday, it was something that we were asking people to prepare that this could potentially be the end of the school year. I would say that we have a number of teachers that are doing a remarkable job in making sure that they're supporting students in their communities. It's a very different world for a K-12 system right now, as many students are working and getting their education from home, and the teachers are doing a very good job in support of those students. So right now it is too early to tell. We said that we would monitor this, but expecting that students would have to prepare this would be the end of the school year as they knew it. Provisions have been made for those that are not graduating this year to continue their education, and getting the extra grade for this year. They move up next year, and we'll work with those that are preparing for graduation as they prepare for post-secondary education through this process. I will say that I give a big shout out to our teachers who are working very closely with those students, very mindful that many of them are preparing for graduation.
Dr. Fitzgerald, you say that we're going to be able to confirm more here now. Are we becoming a national lab here in Newfoundland and Labrador?
So our lab, the Newfoundland and Labrador Public Health and Microbiology Lab, has been doing the tests. And once there's a verification or validation process that's in place, and so they have met those requirements to be able to have positive, confirm positive cases here.
Thank you. Our next question is from Ben Murphy from VOCM News. Please go ahead.
Premier, getting a lot of messages from substitute teachers who are concerned, saying they haven't heard a whole lot about what will be done for them. Many saying they're not getting paid for days that they were booked. What can you say to just help alleviate some of the concerns of substitute teachers around the problem?
Yeah, so we want to work with our substitute teachers. They play a very valuable service to our K-12 system. Also recognizing that the federal government are going through a process right now to support all individuals that find themselves without a job based on the decision of COVID-19. The application process should be available, as the Prime Minister has been saying earlier today, around April the 6th of this year. And so there will be a full program, a suite of programs available for those that find themselves without a job because of the decisions made by COVID-19. Also, from a provincial support, we want to work through our substitute teachers, working with NLTA, which would be their association.
And hearing rumors, and I'll emphasize rumors, the town of Cartwright is blocking anyone who left the community as of yesterday, March 24th, from re-entering. Have you heard anything on that, or can you speak to that?
Yeah, I understand there's a state of emergency in Cartwright right now, and if you're familiar with the community itself, is based on the state of emergency that they put in place. This is largely around some of the vulnerable people that they have in their community, people with suppressed immune systems. I think that's even outlined in their state of emergency. So the community in this particular situation felt it was necessary to put those measures in place to work with the residents and similar to what we've done as a province, similar to what we've done as a country in making sure that when people enter the community, that indeed in this case would be to keep people out, that would reduce the spread of COVID-19 to the community of Cartwright. They're in a position that they can actually do that, and I understand that they're looking at the state of emergency as one mechanism to be able to do that.
Operator, can you find out if we have any further questions?
We only have 2 left in the queue.
Okay, thank you.
So the next question is from Peter Cohen from CBC. Please go ahead.
Question about unregulated daycare spaces. These are usually in people's homes. They've been allowed to stay open, but I know a lot of parents have decided to keep their kids out under the principles of social distancing, but yet there's no financial help available for these places because they're unregulated. Is there anything you're going to do to either help make sure that parents don't have to continue paying for a service they're not using, or making sure that these childcare providers aren't losing out on a vital source of income?
Yeah, over the weekend, we made an announcement that, especially those that are the regulated system, that the parents would not have to pay to keep those spaces available, that indeed anyone that did pay, there would be refunds. In the unregulated system, that is something that we do not provide, operating grants and subsidies, that they work in an unregulated system. So this is really a contract that occurs between the family and that unregulated provider. We work very closely with the regulated system, but in those that are in the unregulated space, that we expect everyone to provide the social distancing, physical distancing that's required to make sure that the child care is provided in a safe way.
But why not provide the same sort of help you're providing to regulated child care providers to some of these unregulated ones as well?
Those, it's an option that people make a decision if they want to be an unregulated or a regulated child care provider. In many cases, not everyone makes a decision to be a regulated child care provider. That's a decision that's made by the operator. Now, in some cases here, we would see that the federal government may have programs that would be available through the EI system, as an example, to support those individuals, not just the unregulated child care providers, but all individuals in our province and throughout the country.
The time for questions has ended. The last caller, if you would email me your question, I will get your answer as soon as possible. Thank you, everybody, for attending.
Thank you. Your conference